House phone-ins. I have the Health Secretary Wes Streeting in front of me now, and without going down too many initials, the NHS might be part of our DNA, but it's sending out an SOS because it could be on the verge of collapse. A very powerful piece in one of the newspapers today, an article in one of the newspapers by the Health Secretary, who's in the studio with me, Wes Streeting. Good to have you on board. Thank you for coming in, very much coming in, Mr. Streeting.
Good morning.
Can you put into words what you've written in the paper this morning, your level of concern?
Yeah, so I think with the flu pressures we're seeing on the NHS at the moment, this is probably the worst pressure the NHS has faced since COVID. There is a lot of flu around, and there is a particularly aggressive strain that's knocking people out and are leading to not just people turning up at hospital, but even being admitted to hospital. Now, if we didn't have strikes looming over us, I would be extremely worried about that situation. This is always a hard and challenged time for the NHS in the run-up to Christmas and the first week of the new year. We could just about cope with that. The idea that we will have to contend with that plus strikes is dangerous, actually. And I am extremely worried about the pressure on staff, but more seriously, the risk to patients if we end up with that double whammy of both flu and strikes. That was why I actually said to the BMA earlier this week, if you are willing to call off these strikes while your members vote on the offer that we've put to you, I will extend your strike mandate to the 2nd of February so that you can rearrange your strikes in January.
Because so that you're saying, get us over this hurdle, and then we'll talk again in the new year.
Because that would do two things. Firstly, it would give BMA members more time, actually, to vote on this offer, to debate it with their colleagues, debate it with me, debate it with their union reps. It would remove the spectre of strikes. Because the challenge we've got now is that, let's say this ballot is successful from my point of view, resident doctors vote for it, call off the strikes. Some of the damage will have already been done because there will be patients who've already had their appointments cancelled and doctors who've had their leave cancelled to cover strikes. And I cannot understand why, when I offered to rearrange strikes in January, why they didn't take up that offer. Because if they wanted to just give me a kick-in, well, there's an opportunity to do that in January. I can only assume that the reason why they refuse to do that is because they know that this week will be most painful for the NHS. Most painful for me, sure, but to be honest, given the pressure that puts on other NHS staff and the risk it poses to patients, I don't understand why the BMA have not been willing to compromise in that way. And I hope that BMA members will bear that in mind when they're filling in this electronic survey and being asked if they will agree to stand down strikes and vote for progress on jobs.
With the collapse of the NHS being midnight, how close to midnight would you say we are, Mr. Streeting? 1 minute to midnight?
Effectively, yeah. The thing that I'm genuinely fearful of is that even if I throw more money at this situation now at this time to get us through the next week on strikes, there's only a finite number of doctors and staff. There's only a finite number of care home beds and community-based care. So if you've got strikes and you've got flu and you've got all of these trolleys on corridors and you've got demand going up rather than down, I just don't think there is a lever I can pull. I don't think there's an amount of money I can throw that means I can sit on your programme and guarantee patient safety over the next week. And that's a pretty terrifying position, not just for me to be in, but for the doctors and NHS staff who are confronting that challenge to be in, because they are the ones that are going to be bearing it on the front line. I'll be there with them. If these strikes are going ahead, I'm not going to bury my head in the sand or look the other way. I'll go and see it firsthand.
You will visit hospitals during the dispute?
Absolutely.
And you'll seek to talk to doctors possibly on a picket line?
I'll talk to doctors anywhere.
We're going to talk to a doctor in a minute.
Yeah, I'm always willing to talk to the BMA.
Can I challenge you on that? Because you'll be aware, Mr. Streeting, that obviously I've been covering this here on the show. And the day after the offer, I spoke with the Deputy Chair of BMA's Resident Doctors Committee, Dr. Arjan Singh, and he said that the offer that you've put, you have not made available in writing. Yes or no?
I don't think that's true.
You don't think that's true?
No, we followed up. I met with the Resident Doctors Committee Chair and members of the committee earlier this week. I made it clear what we were putting to them, which was emergency legislation to prioritise UK graduates.
Without being unnecessarily confrontational, a lot of people would like to see a politician's promise in writing.
Yeah,
Mr.
and
Streeting.
we wrote to the BMA to set out the terms of the offer.
Okay, thank you. Let's get some calls in, and indeed we start with a doctor, Anthony in Epping, and you're through to the Health Secretary. Anthony, go ahead. Morning.
Hi, morning, Nick. Morning, Wes. Thank you so much for having me on. Wes, I am going to keep this very simple for you. Why should I, as a resident doctor, or as you prefer to call me, a juvenile delinquent, vote for your deal? If I can just say, my colleagues and I feel incredibly deceived by what's on the table. So far this year, 30,000 doctors have applied for 10,000 specialty posts, and 5,000 doctors, myself included, finished foundation training in August with no job, no training post, no clear future in the NHS. Not because we don't want to work, but because there aren't enough jobs. And what you're saying is by adding 4,000 jobs, you're not, at the end of the day, you're not making up the gap. And 1,000 of these jobs are non-training posts that are being repurposed. So when doctors are rejected from training next year, there will be even fewer jobs left. And you're not increasing the number of consultant posts either. So you're not fixing any bottlenecks that exist in the system.
I will stop there because I want to get I'm not cutting you off, and I want to get Health Secretary in. Just, of course, to help my listeners, it was earlier this month, Health Secretary, you accused the British Medical Association of juvenile delinquency, and they were moaning minis, just to put in context Anthony's comments.
Yeah, I have been very critical of the BMA's leadership.
Is he a juvenile delinquent?
That's true. Well, I don't know Anthony, and I'm not going to...
But if he takes action,
I'm not going to insult him. But what I would say to Anthony is what he's just said isn't quite right. He is right to say that we are increasing the number of specialty training places from the 1,000 extra that we promised in our 10-year plan for the next 3 years to 4,000.
And they're permanent posts.
Yes, we're bringing forward 1,000 of those to the current application round. Now, he's right to say that those posts might otherwise have been what are known as locally employed doctors. But the reason why we're converting them into specialty places is because the complaint I've heard from the BMA and heard from doctors in those posts is they don't just want to be locally employed doctors in temporary jobs. They want to be in specialty training. So we're doing that. That's the first thing. The second thing that I really want to land with both Anthony and other resident doctors, because I think this point is definitely being missed. We're bringing forward, if they vote for this offer, emergency legislation in January, which will prioritise UK graduates who've trained here in the UK over applicants from overseas. Because as we discussed the last time I came on your programme, Nick, one of the reasons you've got 40,000 doctors applying for just 10,000 places is because loads of those people are applying from overseas. Now, if that emergency legislation is brought in and we get it through, the application rate goes from 4 to 1 to less than 2 to 1, and also will therefore open up a new application round in the spring that means that some of, I think Anthony may be, but certainly many of Anthony's colleagues who've received rejections in recent weeks will have a new chance to get a specialty place. Right. So we go from 4 to 1 to less than 2 to 1. I don't know about you, Nick. I would love to apply for a job where I've got a less than 2 to 1 chance of getting it.
Don't start talking about applying for jobs, because you know that will take us, Wes Streeting.
So I hope that reassures Anthony. I really, really hope that Anthony. I'm ignoring you. I really hope that Anthony and his colleagues.
Well, we're going to come back to Anthony. I just want to because I want to bring it up. Anthony, please hold on the line just to clarify, because Dr. Singh, the gentleman to whom I referred earlier, he said these 4,000 posts are not permanent. You are telling me they are permanent?
Yes, because they're specialty training place that people.
Let's bring another resident doctor in, Joss in Highgate. Joss, the other doctor is listening to you, as is the Health Secretary. Over to you. Good morning, Joss.
Hi, morning. Nice to speak to you both. I'm an F2 resident doctor who, from August, will be one of those doctors that already knows they're going to be unemployed.
Right.
I've been in the NHS for working since COVID in various jobs for 5-6 years. I don't want to leave, but I feel like I have been forced out a little bit, but I will be voting for this deal. My question is...
Why will you vote for the deal? Tell me what's in the deal that appeals to you then, Joss?
Because I think if you look at the progress that has been made in the past 2 years for resident doctors with pay, which I know has been controversial to bring in, so I recognise there's some political sacrifice that was done by the Health Secretary for that. I also think that the progress has been made in terms of training positions. And actually, when I listened to your phone in a few weeks ago on the last resident doctor strike, and I could hear that the Health Secretary, or Wes, really did mean, it sounded like he meant what he said. So I do want to give some good grace and not go on strike this time round. My main question at the moment would be, what assurances can you give me as a resident doctor who will be unemployed come August that the changes that you're proposing will be brought in? And is there anything that you can do for someone like me who will be unemployed in August? Will these 1,000 jobs be open for someone like me?
Thanks, Joss.
Yes. So, firstly, Joss, and just let me just say, not just to you, but to resident doctors right across the NHS, I'm really sorry that we are in this position where poor workforce planning over many years now has meant that people like you have gone through medical school, taken on that debt, thrown your heart and soul into it. It's hard to get into medical school. You work hard, you come out the other side, not unreasonably expecting that the NHS, especially in its current state, will have a job for you and you will be able to progress. That has not been happening, and that is the thing I've been trying to solve with this latest offer. And so the combination of those 1,000 places that we're bringing forward, plus UK prioritisation with the emergency legislation, because I think this is, to be honest, and I know Jack Fletcher, the chair of the Resident Doctors Committee, also agrees with this point, at least I'm about to make. It's the legislation that's really the game changer in terms of reducing the amount of competition for places. We're going to open up a new application round in the spring that will give fresh hope to people like Joss, and therefore I hope resident doctors will vote for it. The broader point I'd make just on pay
briefly,
and all of these other,
because I have so many calls.
All
to
of these,
Mr.
yeah,
Streeting.
on these wider points, I'd just say to resident doctors.
Well, I want you to bring. I'm going to bring Anthony back. Joss, thank you.
Bring Anthony back.
Anthony, I don't normally do this, but you've heard a colleague who is actually going to vote in favour of the government deal. You've heard Mr. Streeting's response. Briefly, how would you like to reply? And I don't often afford this opportunity. A brief response from you, Anthony, if you would.
I would just say that the deal that is on the table currently doesn't deal with pay enough. It doesn't deal with pay at all. The 28.9% figure that's been bandied about by Mr. Streeting, it's been over a number of years. It completely negates the inflationary effect of doctors that doctors have experienced since 2008. So,
all right, well, let's...
I'd say a couple of things. Firstly, on jobs, Anthony, this is a substantial improvement from 4-1 to less than 2-1. Secondly, on pay, you are right that 28.9% pay rise covers a 3-year period. But honestly, there are not many people certainly there are none in the public sector, and there are very few beyond who've had a 28.9% pay rise over the last few years. Now, I know that's not as far as you might want me to go, and the BMA might want me to go. It is as far as I think the country can afford right now. And I just ask you, whether it's on pay or whether it's on jobs, do not let perfect be the enemy of good. And this is the final point I will make. Strike action should always be a last resort. And I could not understand, and still cannot, why we've already had 2 rounds of strike action following a 28.9% pay rise. At this stage, when we are a week before Christmas, when you know the challenges the NHS is under even better than I do because you're working in it, I cannot understand why, when there is this jobs offer on the table that we've put together at breakneck speed through emergency legislation, why you and your colleagues might still vote for strike action now. I do not understand why your union did not take up a reasonable compromise of at least postponing strike action till January if what you really want to do is give me a kick in. But for goodness sake, at this stage, voting against this offer, voting to go on strike, it's self-defeating for doctors. It puts untold pressure on other NHS staff who are going to be working in those conditions. And I do not make this point lightly or casually, it risks serious harm to patients.
Does it risk death?
I cannot guarantee. Honestly, Nick, I don't want to catastrophise or sensationalise. I cannot sit here and look you in the eye and tell you that no patient will come to harm or fatal harm. I cannot make that guarantee. So I urge doctors, please vote for this offer, end these strikes, and let's try and start 2026 with a fresh start. I'm happy to hit the reset button in terms of my relationship and the government's relationship with the BMA. I hope that they're willing to do the same. We could all do without this war of words. Right. And I do want to improve the lives and conditions of doctors and other NHS staff, and most importantly of all, get our NHS further down the road to recovery.
Anthony, thank you. Joss, thank you, and thank you for the work you do. Question here from Piers in Kent on a text. Does Wes Streeting agree that the BMA now is more a political organisation than a health organisation?
To be honest, it feels like it, in the interest of diplomacy and recognising what I've just said about hitting that reset button. I will resist the temptation to express fully my frustration with the BMA.
Do you regret the language of juvenile delinquents and moaning minis from earlier this month?
Well, it was aimed, let me just, for the avoidance of doubt, it was aimed squarely at the BMA. And I'll tell you what part of my frustration was, because
they are members who we've just been speaking with.
I'm not attacking doctors, but
do you regret the language, Mr. Streeting?
No, not really, because I'll tell you what my frustration was with, because I think the moaning minis comment was in relation to the BMA on general practice. I'll tell you what my massive frustration was. Satisfaction with access to GP has gone from 60% to 75%, and we've rolled out online access to almost every surgery in the country. I think that is a massive cause for celebration, not for the government, but for GPs. And the GPs get it in the neck all the time, in the newspapers, in phone-ins, and I thought it was a real opportunity for government and the BMA to say together, look at what a brilliant job general practice is doing. It's not all solved. There's more to do. We know we've got to do more, but this is a really, really strong start. Instead, the BMA was saying, this is all terrible. And that was my frustration. But look, okay. I'm willing to turn over a new leaf and adopt a new style of diplomacy with the BMA in the new year, if we can hit this reset button, if we can call off the strikes and work together. And let me just say, because I was critical of the BMA GPC chair, Katie Bramall, she has also used some intemperate language for which she has expressed regret and said sorry. So actually, Nick, in that spirit of goodwill, let me also repay that and say to Katie and her team on the BMA GP committee, I regret some of the things that I've said too. Let's end the war of words and work together in the new year.
I'm a peacemaker. I am radio's Henry Kissinger.
Blessed are the peacemakers, Nick, for they shall be called the children of God.
David's in Dagenham. David, you're through to the Health Secretary. Go ahead. Good morning.
Hello there, good morning. My question for the Health Secretary is that flu cases are rising in many parts of the country and schools are trying to balance good attendance with pupil and staff well-being. So with that in mind, what specific practical steps does the department expect schools to take at this point, and will there be any updated guidance if cases continue to increase? Are you
in education, David?
I am a head teacher of a junior school in Dagenham, East London.
And it's still open? Oh, very close to Mr. Is it still open for business?
Absolutely. Still open and still enjoying our Christmas events, but we are noticing an uptick in absences at the moment.
Straight to the Health Secretary.
Yeah, well, firstly, good luck. I know that this is a time of year when teachers are absolutely knackered after a really busy term, and I'm really glad you're still going. I'm really glad the Christmas parties are still going for the kids as well. That is all fine. The important thing, particularly for parents to know, if your children have flu or flu-like symptoms, not only is it okay to keep them off school, it's the right thing to do. You don't want them to overexert themselves with the flu, and you definitely don't want them spreading it around to other kids. So keep them at home. We've got to keep schools on the show on the road. It's terrible when children learn learning.
Mr. Streeting, you're aware of that?
Schools will only close in extreme circumstances and on the advice of the local public health authorities. And that might be, for example, if there's a particularly nasty infection and there's a need for a deep clean or something like that. But schools will not be routinely closing, and they should not routinely close.
Should we routinely wear masks?
Not routinely, but again, this winter, it may be if you're visiting a relative in hospital or you're going to a care home, they might say, please wear a mask.
But not
and
if you're
they
walking
do,
down
you
the high
should.
street. We don't need to wear it to go to the supermarket.
No, people might, and I do sometimes see people choosing to do that. That's okay, but we're not mandating or asking people to do that.
All right, just lastly, you mentioned Christmas shows. What was the biggest challenge in playing Tiny Tim? I read about that in the New Statesman when you were a child. What was the biggest challenge there?
Do you know, considering I only had 2 lines and they were both the same, which was God bless us everyone, my recollection in the auditions, after the auditions, when I was doing the rehearsals, was I kept on forgetting when to come in. But yes, no, I enjoyed playing Tiny Tim, but not as much as I enjoyed playing Scrooge.
Let's talk about Flu. Let's talk about Scrooge. Now, let's not go back to the Doctors.
That was a year 4 starring role. God, we could go through all of my. I played Fagin in year 13.
You were Fagin. I can see you now being mocked up in the sun. They're getting it now. You've done a Scrooge and Fagin. On we go. Let's talk about the availability of jabs. Susanna in Woodford. I've just tried to book a private flu jab locally. No stocks, and they're saying they've no idea where they get some. People are trying to follow the advice but can't. What are supplies like, asks Susanna.
Supplies, Susanna, should be fine.
Well, respectfully, they're not. She's just tried.
Now, there may be, and I saw a report about Boots earlier this week, and we were straight in touch with Boots. There's no shortage of the flu vaccine. I think what's happening is demand is high, which is a good thing, so people are clearly following the advice. And it may be that in certain locations they get caught short on a particular day. We are working with the supply chain to make sure that we can get the vaccine to people as quickly as possible. So my advice to people, if you're popping along to your local pharmacist or a place you'd normally get your flu jab and they've run out, go online and see if there's somewhere else nearby, because the chances are there will be.
What site do you
go onto the NHS website.
The NHS website, I see. OK, all right. Let's get to more calls. Thanks, Susanna. Harriet in St Albans. Harriet, you're through to Wes Streeting. Go ahead. Good morning.
Good morning. Good morning, Mr Streeting.
Good morning.
First of all, I work in a maternity unit. I don't know if your listeners know, but 68 units out of the 119 maternity units across the UK are rated requires improvement or inadequate.
Yeah.
I've been listening
We
morning,
and I spoke, didn't we? We spoke earlier this week.
Did.
Yeah, I recognise your voice. Go ahead, Harriet.
I have just finished another night shift as well, which, again, we were 4 short. You
4
said
short
earlier,
of how many? It should be 8 from memory, shouldn't it?
well, last night we were 2 maternity support workers and 2 midwives short. So
Right, okay.
we still had to close a ward to enable staffing to be adequate enough.
Right.
But again, still, we're all drowning. We're all still there.
Right.
You mentioned earlier, Mr Streeting, that you were worried about the dangers of flu, and you stated, I'll quote, that it was dangerous. Now, in maternity, we are not only looking after 1 patient, we are looking after 2. Our funding has been considerably cut. What are you going to do about it? When are we going to get the funding? When are we not going to be a dangerous service?
Well, firstly, thank you very much for calling in, and the numbers you reported there in terms of the number of maternity units that requires improvement and the proportion that represents is exactly why I've commissioned an urgent national investigation into the state of maternity care, because while we've had some very high profile and frankly horrific examples of failures in specific trusts, I didn't want people to be lulled into a false sense of security that the problem is confined to a few very challenged trusts. I think we have a widespread problem in maternity and neonatal care that's been years in the making.
You won't have heard Harriet's call, but I spoke to her earlier this week. Instead of there being 8 staff, there were 4. They're routinely down on midwives or other nurses. How is that allowed to happen?
Well, we are recruiting and will continue to recruit more staff. However, I think what I suspect we're hearing reported, and Harriet can tell us if otherwise, but I think we've got a lot of staff sickness absence, a lot of staff stress and burnout, which we need to deal with, and we've got, sitting beneath that, problems of culture, problems of practice, and I asked Valerie Amos to to look at the state of maternity services, to look through, frankly, the reams and reams and reams of recommendations.
748
that have been
over the past 10 years.
That have been made, some of which have been acted upon, others of which have gathered dust on a shelf. So we'll do a full audit of all of that and then pull out the key urgent actions and priorities that are needed, as well as the wider, longer-term reform and modernisation plan. One thing I just want to ask Harriet, because we're putting £26 billion more into the NHS, we are also spending more on clinical negligence in maternity than we are on maternity services themselves, which I think is shocking, and I want to turn that around. But I just want to hear from Harriet, describe a bit more to me, for my benefit actually, as much as your listeners. Just tell me a bit about what's actually happening on the ground in your trust, Harriet, because it concerns me that you're describing cuts at a time when we're putting more money in. So I want to understand what type of decisions your local trust leaders and your ICB are making about funding for your service.
Harriet.
Thank you. Well, actually, the main decision at the moment is they are not putting bank staff out. Basically, they're not putting those shifts out. You are correct. We have got a very high level of sickness. With regards to maternity staff, actually, the main from the NMC insights, one of the main reasons for midwives either leaving within their training or newly qualified or even years down the line is the staffing levels. They are concerned that they cannot give that quality of care to the public. Now, from our trust, for example, when we were last week, we had the most horrendous week. We were so short-staffed. Those shifts were not allowed to be put out to the bank members, which they would have, some of them would have been filled, because from very, very high up above, they're saying there's no funding. You cannot put that out. We haven't got the money. Now that puts not only our service users in danger, that puts staff in danger. We had, like I said to Nick earlier this week, we had staff in tears on the ward. We are all exhausted. We are burnt out. We need people. We've got newly qualified midwives who can't get jobs, just like your doctors. They've spent £30,000 plus for 3 years training. They've got nowhere to work.
Yeah,
I have to move.
Yeah, we worked on that latter point, and we worked really intensively over the summer with the chief nurse and chief midwife to try and make sure we got people linked up to places. But Harriet, can you? I don't want to do sort of a name and shame on air, but if you wouldn't mind just dropping me details of the trust, because I can go and look at what's going on there, and if there's more we need to do as a government to be supportive, I can look at that as well.
Harriet, TV your details, and I know from past experience that Mr. Streeting or his team will be turned to pretty rapidly. Can I put a question to you? You mentioned there the Amos review. Can I talk to you about the Cass review?
Yes. Where
the government implemented, the Conservative previous government, implemented a temporary ban on the use of puberty blockers in children. You'll be aware, Secretary of State, we now have this new trial in which 226 children, some as I read as young as 10, are going to be given this drug under this Pathways trial. Why?
So the Cass review, which was, as you say, commissioned by the previous government, led by one of the country's most experienced leading paediatricians, looked at what we do and need to do to support this particularly vulnerable group of children and young people who are suffering distress with their gender. And what Hilary Cass uncovered was kind of utterly shocking levels of unprofessionalism, lack of proper clinical oversight, and the prescription of puberty blockers without evidence. My Conservative predecessor, Victoria Atkins, introduced a temporary ban just as the general election was underway. When I came in, I upheld that and then extended it to become a permanent ban. But Hilary Cass also recommended that we do a proper study. The Pathway study involves a whole range of treatments and care, including therapeutics or mental health support, but it also included a trial on this puberty blockers thing. And I'm not comfortable, candidly, about it.
Why are you allowing it?
Because the two overriding concerns that I have, the only two really, are firstly, how do we keep these children safe and how do we make sure they receive effective and evidence-based care? And secondly, to follow clinical advice rather than. I mean, I've got loads of incoming. I've had my constituency office windows put in 3 times by trans activists and received all sorts of threats. Since this trial has been announced, I've been called all the names under the sun online and received some pretty nasty stuff. To be honest, the extreme stuff I don't care about anyway. The political noise I kind of put to one side. I'm following clinical advice.
So what is the cause of your discomfort? Because
I just, there's something about the sort of the opposition to this and medication that delays or indeed stops a natural part of our human development, which is puberty, I am deeply uncomfortable with. Now, the clinical advice is to go ahead with the trial, and those who advocate this medication, and lots of other countries are using medication in these cases, suggest that for trans people, this is a better course of treatment than leaving them without, and with all of the distress and harm that can cause.
But Mr. Streeting, how does a 10 or 11-year-old give his or her consent?
Well, that is a good question. So in order to take part in that part of the trial, they will have had to have undergone thorough mental and physical health examination by doctors. They will then need to be approved by the local clinical trial team. There is then national clinical oversight, and crucially, they will also need the consent of parents. And it's gone through rounds and rounds of ethical approvals to approve this kind of study. So that's the base upon which we are proceeding. We're following that evidence. As I say, it doesn't sit comfortably with me. I'm trying really hard as a politician not to interfere or block clinical advice by people who are frankly far more qualified than me. And, there will be debate on this. And one thing we've learned in this whole area is not to shout down people who've got concerns.
But how do we know if it's worked, lastly?
There'll be regular reports, and obviously that's the benefit of a trial like this, is that it produces a study report.
All right, final call. We'll get 1 minute, last one. Hannah in Yeovil. Hannah, your question, if you would, briefly.
Hi, Nick. Good morning, gentlemen.
Hi.
Good morning.
Mr. Streeting, can you categorically rule out a leadership challenge on a joint ticket with Angela Rayner, yes or no?
Yes.
We almost got to the end of the show.
Yes. Yes is the short answer.
Are you disappointed, Hannah?
Yes is the short answer to that.
Not at all, no.
No, you're not. OK. I have to ask you, Mr. Streeting, in an interview you said the following: the problem with a practical, technocratic approach is if someone says, I've got a maintenance company and mine's cheaper, why wouldn't people go, OK, we'll give that maintenance team a try? Is the Prime Minister then too technocratic?
No, it's not a criticism of the Prime Minister. I think it is a challenge to all of us, because all of us in government and in the Cabinet in particular have a responsibility to get the government's message across. And sometimes I think what we're guilty of is coming on and listing a whole load of stuff we've done. Now, that's a good thing, because we've done loads of stuff since the elections to deliver our manifesto. The problem with big, long shopping lists is you can't always remember what's on it, and people kind of walk away thinking, I kind of heard some stuff they're doing, but I can't quite remember what it's about. We've got to be much better at putting an account of what this government is about and who it's for. We'll take this issue of child poverty. Like, I was at, I don't think Steve would mind me saying this, I was at Cabinet meeting earlier this week, and Steve Reid, our Housing Secretary, was reporting that we've seen, I think, something like over 60 children in our country have died in temporary accommodation in the last 5 years. Now, if a serial killer had killed over 60 children in our country over that length of time, it would be splashed on the front of every newspaper. We would remember the name of that killer with infamy for the rest of our lives. But in this case, children are quietly dying. Their parents do not have a megaphone or a microphone, and they are dying in shabby temporary accommodation. What this government is doing is lifting 500,000 children out of poverty by abolishing the 2-child limit. We are tackling homelessness, street homelessness and rough sleeping, but also trying to end that temporary accommodation with £3.5 billion. Well, I think at the moment, let's be honest, politicians aren't very popular, full stop. We came in not just to a broken economy and broken public services, but broken trust in politics, and that does take time to turn around. But also, we've got to give a much better account of what we're doing, who we're fighting for, and what we're fighting for. On the NHS, for example, we're cutting waiting lists for the first time in 15 years.
Yes, you are.
Patient satisfaction with GP has risen from 60% to 75%. Ambulances were arriving about 10 minutes faster this autumn, this year, than they were last year. So things are beginning to improve. It's on the road to recovery, but there's more to do.
But lastly, you'll have seen the GDP figures over the last 3 months. 0.2 down to 0.1. We go into a new year at minus 0.1. You might be fixing the NHS, but your colleagues aren't fixing the economy.
Well, we're definitely not out of the woods on the economy, and the Chancellor isn't happy with those figures. We have, at points since we came in, had the fastest growing economy in the G7.
Well, please don't tell me our listeners that.
But as the Chancellor said, the economy is not out of the woods, and she got
going backwards.
She got quite a bit of flack, didn't she, just ahead of the budget when she stood up and said that things are very challenging. I'm going to have to make some difficult choices, and she got a lot of flack for that. But Rachel's following these numbers really closely, even before they're published, and so when she's out there warning us about the health of the economy and what she's doing to tackle it, that's why. So we do need to do better. We know that. And look, I think the approach we've got to take as a government, Nick, when we're doing well and when things are improving, we've got to come on, say so, tell that story and give people confidence and hope that the country is moving in the right direction. Where it's not going well, we've got to hold our hands up, say this isn't good enough, we're going to do better, and take the criticism on the chin. That's what Rachel is doing on the economy.
I've made you late in your schedule. A resident doctor listening now can't decide. They vote over the weekend, as I understand it, and then on Monday morning we get... So over the weekend, this doctor, he or she, just doesn't know which way to go, kind of is persuaded by the BMA, has just listened to Wes Streeting on LBC. A final... Can I use the word plea? Is that too...
No, plea is absolutely the right word. If you vote for this deal, it means that right now, for people who've had job rejection letters in recent weeks, we reduce the competition for specialty places from 4 to 1 to less than 2 to 1. It means we increase the number of specialty places, extra specialty places, to 4,000, with 1,000 of those being delivered right now. It means that we can start the new year with a fresh start, with no strikes this Christmas. Better for patients, better for your colleagues, and better for you. And on pay, we've had a 28.9% pay rise. We haven't even got to the next pay round yet. And of course, we can talk to your union about that well ahead of time. We can do that in the new year. We've made a lot of progress together, not just on pay and on jobs, but on the NHS itself. Don't put that recovery at risk. Don't make lives of your colleagues harder next week, and don't put the lives of patients at risk. Work with a government that wants to work with you, vote for the deal, and let's start 2026 with a good deal and a fresh start.
Wes Streeting, thanks for your time this morning, appearing here on LBC 9:38. Let's get some headlines.
Thank you.
The Health Secretary Wes Streeting has told Nick the NHS is facing its worst pressure since the pandemic. He has urged resident doctors in England to call off their pre-Christmas strike as hospitals face a surge in flu cases.
I cannot understand why, when I offered to rearrange strikes in January, why they didn't take up that offer. Because if they wanted to just give me a kick-in, well, there's an opportunity to do that in January.